Where were you? Do you remember when you heard that this virus that seemed far away was not so far away anymore, and it was, in fact, a global pandemic?
Yeah, I remember exactly where I was. And now that I think back, it sort of brings me chills because I have to admit, I didn't think that it would have rolled into Canada with the degree of tenacity and fury that it did within long-term care homes as quickly as it did, and through a lot of vulnerable populations. But that being said, I think it's been an incredible testament to science and research and a community that can collaborate in remarkably short periods of time to engineer life saving vaccines. And I think that's something that has been a huge lifesaver. 6 million people have died, but I think millions and millions of more people could have died had it not been for that and a lot of the research initiatives that have been just fantastic when the will has been imposed and collaboration has been done.
Dr. Sharkawy, do you think we will ever know the origins of the virus?
Boy, I don't know. I think it's going to be something like the JFK situation. There's going to be conspiracy theories. It's going to be very difficult to determine. Frankly, I don't know that we need to search very far. I think that this is a very predictable scenario. The first SARS was a predictable scenario, and I think it's a combination of a lot of practices that are not necessarily safe when it comes to preventing the transmission of viral diseases of pandemic potential. And that includes better care of our agro industry. It includes better control when it comes to infection control measures that are taken in different parts of the world, and really an early warning system and a communication system that I think is put into place much more aggressively and taken much more seriously by everyone around the world once there's a notification from anywhere. I think a lot of people were slow, and there was a lot of doubt as to whether we needed to take the threat seriously. And unfortunately, that certainly costs lives.
And there were lots of up and downs over the past couple of years. A lot of waves came and went. We thought it was over, then it came back. What would you say was the biggest lesson that we've learned? What's the one takeaway for you?
I think we have to remember that when you're dealing with something that's this overwhelming and this complex, we need to be very patient. I think we need to be very open minded, adaptive in our responses. When we become very polarized in our thinking and we are dogmatic about things, we are going to find harm, because I think this has been a test of unity and a test of being able to bring people together. And unfortunately, whether it's vaccine hesitancy or masks being politicized, there's been a lot of polarizing of opinions and a lot of labeling, and that's created barriers, and it's prevented everyone in our society from pulling on the rope in the same direction. And we have to remember that it's us against the virus. It can't be us internally fighting amongst ourselves, because that's why this pandemic has lasted as long as it has. We have to support each other. We have to support the vulnerable. We have to be more giving to one another. And if we can do that and be more patient, then we can stave off some more catastrophic future pandemics. But I think if we don't learn those lessons, unfortunately, we'll see them again.
Dr. Sharkawy, one final question for you this morning. If you had a crystal ball and you were going to look into it, where do you think we'll be in 5 years with Omicron or COVID-19, whatever at that time we're calling this virus? What do you think it's going to look like?
I think it's clearly going to become endemic. I would imagine that it's likely going to be much more seasonal in nature and hopefully more aligned with the flu season and not the spring and summer, as more people develop immunity and there's at least some degree of cross immunity from one variant to the next. But I don't want to get my hopes up too high. I think we have to be very careful and learn the lesson that variants emerged because we weren't careful enough, because we let our guard down too quickly, because we wanted to turn the page, because of fatigue, because of our own political beliefs or anything else. And the virus doesn't care about that. So we've got to enlist a lot of solidarity together, work on infrastructure like improving ventilation standards and really work on the inequities and the systemic determinants of health that are underpinning why a lot of people suffer disproportionately.
Dr.
If we do all of
Sharkawy,
those things, we're going to be in much better shape.
in much better place. Dr. Sharkawy, thank you so much. Good to see you. You take care. Be safe.